Perform the individual manual muscle test for extensor pollicis brevis. The patient is seated at the table with a forearm supported on the table in neutral pronation supination. The thumb is extended with the metacarpal phalangeal joint extended, and then the distal interphalangeal joint, or the interphalangeal joint rather, relaxed. Actually, let's shoot that again because that was a really stupid mistake. Okay, take 2. Here we go. In order to perform the individual manual muscle test for extensor pollicis brevis, the patient is seated at the table with their forearm supported on the table in neutral pronation supination. The thumb is held in extension with the metacarpal phalangeal joint in extension, and then the interphalangeal joint is just flexed or relaxed. You stabilize the metacarpal of the thumb, and while the patient maintains metacarpal phalangeal extension, you apply resistance to the dorsum of the proximal phalanx in the direction of metacarpal phalangeal flexion. Hold that back. Don't let me move. Hold, 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 hold. Okay? This is normally a weak muscle, so you'll have to judge whether it is a normal or 5 out of 5 as compared to other normal subjects. The substitute movements for this would include if the IP joint is hyperextending, or if the CMC joint is retropositioning back in this direction. That would indicate abductor pollicis longus or extensor pollicis longus substitution. The tendon for the extensor pollicis brevis is palpated at the radial wrist, just distal to the radial styloid, and right through there, extensor pollicis brevis shares that first dorsal compartment with the abductor pollicis longus. The extensor pollicis brevis is the dorsal of the 2 tendons.